Good morning, everyone, and welcome. Today, we're going to explore the important topic of youth conduct problems. We'll take a close look at the causes behind these behaviors, the challenges they present, and importantly, the evidence-based interventions that can help address them effectively. I'm looking forward to sharing insights and strategies that can make a real difference. Let's dive in. When we talk about youth conduct problems, we're referring to behaviors in young people that go against what's expected by their families, society, and violate the rights of others. These are actions that aren't appropriate for their age. The behaviors can vary widely, from small acts of rule-breaking all the way to serious aggression and delinquency. While it's important to note that some types of youth violence, especially lethal violence, have decreased in the U.S. since the 1990s, antisocial behaviors among youth are still unfortunately quite common. These issues affect young people across all genders, social backgrounds, and family types, showing that no group is immune. The concern goes beyond just individual families or schools. Conduct problems have a broad societal impact, leading to disruptions in communities and causing real harm to victims. This is reflected in high rates of arrests, incidents of school violence, and the severe consequences related to crimes committed by youths. It's clear that addressing these problems is crucial for both public safety and the well-being of young people themselves. Let's look at some real-life examples to understand conduct problems better. First, there's Andy, a 4-year-old who showed intense rage by throwing a metal fork in a way that almost hurt his parent. This highlights how early and severe these behaviors can sometimes appear. Then we have Marvell, whose defiance shows up both at home and school. She refuses to follow rules, disrupts her classes, and often has tantrums, illustrating how conduct problems can affect multiple areas of a child's life. Nick seems outwardly normal at first, but by age 10, he had already engaged in serious aggressive acts like arson, violence against siblings and animals, and even theft. His case reminds us that hidden behaviors can escalate if not addressed early. Finally, Steve's story is particularly complex. His violent act of stabbing his abusive father reveals deep family trauma, showing how conduct problems can intersect with defense mechanisms and past abuse. These stories highlight the diverse nature and serious impact of conduct problems in children. When we talk about why this topic matters, it's important to understand the broader context and the impact on society. Most adolescents will break rules now and then, which is fairly common. However, those with conduct problems take this to another level, engaging in more frequent and severe antisocial behaviors. These behaviors don't just affect the individuals but create significant costs for society as a whole. These costs are felt across multiple areas: education, healthcare, social services, and the criminal justice system. In fact, conduct problems rank among the most expensive mental health issues due to their wide-reaching consequences. From a legal standpoint, conduct problems often involve delinquent acts that bring youth into contact with the court system, highlighting the intersection with criminal behavior. Psychologically and psychiatrically, these behaviors are viewed along a spectrum of externalizing problems, including both rule-breaking and aggression. Some of these behaviors qualify for diagnoses like oppositional defiant disorder and conduct disorder, which help clinicians better understand and treat these challenges. Finally, from a public health perspective, addressing conduct problems requires a comprehensive, multidisciplinary approach. This means focusing on prevention, early intervention, and efforts to reduce the social harm caused by these behaviors, aiming to improve outcomes not just for individuals but for the community as a whole. When diagnosing conduct challenges, the DSM-5 gives us clear criteria for oppositional defiant disorder, or ODD, and conduct disorder, or CD. ODD is marked by a recurring pattern that lasts at least 6 months, where an individual shows an angry or irritable mood, engages in argumentative or defiant behavior, and sometimes displays vindictiveness. The severity of ODD depends on how many symptoms are present and whether they appear across different settings, like at home or school. Conduct disorder, on the other hand, involves more severe antisocial behaviors. This includes aggression toward people or animals, destruction of property, deceitfulness or theft, and serious violations of rules. An important factor with CD is the age when symptoms begin. Early onset CD, which starts before age 10, tends to be more severe and persistent than cases that begin in adolescence. Finally, understanding the severity of symptoms is crucial because it directly influences both treatment decisions and the expected prognosis for individuals with ODD and CD. By assessing these aspects carefully, we can tailor interventions more effectively to meet each person's needs. When we look at youths with conduct problems, it's important to understand that they often face challenges beyond just their behavior. Many of them have cognitive and verbal deficits, meaning they might have lower IQ scores or struggles with language skills. These difficulties can make it harder for them to control their impulses and to understand or share the feelings of others, which we call empathy. This combination of cognitive and verbal challenges plays a big role in how they interact with the world and why they might find it difficult to regulate their behavior. Oppositional Defiant Disorder, or ODD, is most commonly diagnosed in childhood, with about 12% of individuals experiencing it at some point in their lives. On the other hand, conduct disorder, or CD, tends to become more prevalent during adolescence, affecting roughly 8% of teenagers. These differences in timing highlight how these disorders can develop and change as children grow, which is important for early identification and intervention. Understanding when each disorder is most likely to appear helps us tailor our approaches to support those affected more effectively. When we look at what causes conduct problems, it's clear that multiple factors come into play, often interacting in complex ways. For instance, parental criminality is a significant contributor, as it directly affects the family environment. Families experiencing instability and stress often do so within larger social and political contexts that influence their daily lives. Neighborhood poverty is another critical factor. Living in impoverished areas can create environments where antisocial behaviors are more likely to develop. Economic hardship doesn't just affect resources, it also increases family stress and can lead to inconsistent parenting, which further impacts a child's behavior. Parenting styles play a major role too. Harsh or inconsistent discipline can encourage conduct problems. Social disorganization in communities and cultural attitudes toward aggression also shape how these behaviors manifest. Moreover, exposure to violent media through television, video games, or social media can reinforce aggressive beliefs and behaviors, making it harder for children to develop positive social skills. Prenatal factors, such as low birth weight or exposure to toxins, might influence conduct problems, although the direct links are still unclear. And finally, neighborhood crime itself creates an environment that can push children toward antisocial behavior. Understanding these layered influences helps us appreciate why conduct problems are often so challenging to address. One effective approach is parent management training, or PMT. This program equips parents with practical skills to manage and improve their child's behavior. It focuses on consistent discipline, careful monitoring, and encouraging positive interactions. PMT is particularly beneficial for children under the age of 12, helping to create a supportive environment that fosters better behavior patterns over time. By empowering parents, it addresses issues early and promotes lasting change. When we talk about conduct problems in youth, we're referring to a range of antisocial behaviors that are inappropriate for their age and can have serious consequences not just for the individual but also for their families and society as a whole. These behaviors can vary widely, from the defiant actions seen in oppositional defiant disorder, or ODD, to the more severe aggression and rule-breaking associated with conduct disorder, or CD. It's important to understand that these problems don't arise from a single cause. Instead, they are influenced by a complex interplay of genetic, neurobiological, family, social, and cultural factors. Additionally, kids with conduct problems often struggle with other disorders like ADHD, depression, or anxiety, which can make treatment more challenging. Recognizing differences between boys and girls and how these issues develop over time helps us tailor diagnosis and treatment more effectively. When it comes to treatment, there are evidence-based approaches that have shown positive results, such as parent management training, problem-solving skills training, multisystemic therapy, and early intervention programs designed to prevent these problems before they escalate. Finally, there are some essential terms to keep in mind. The Adolescent-Limited path refers to behaviors that are mainly seen during teenage years, but don't persist into adulthood. Callous and unemotional traits describe a lack of empathy or remorse in some youths. Conduct disorder is the clinical diagnosis for serious conduct problems. Coercion theory helps explain how negative family interactions can maintain problematic behavior. And externalizing behavior covers a range of outwardly directed behaviors like aggression and defiance. Understanding these concepts helps us get a clear picture of the challenges and the best ways to address them.